What a beautiful afternoon here in Nashville and in Madison. Thank you, 50 Forward, for your partnership and participation in All of Us, the research program. I am proud to have this launch here in District 8 at the Madison Station 50 Forward location and the future site of the beautiful roundabout and complete street, Station Boulevard, under construction in just the next few weeks, as well as being the neighbor to the future Madison Town Center that will provide housing, jobs, and a beautiful civic space for our community. Everyone here is somebody different to certain people in your life. You are a mother, you are an uncle, a brother, a sister, a colleague, a friend, a council member, a young person, a senior, or an aging boomer like me. You know all the demographics that you fit into. I'm speaking today as the first out woman elected to a legislative body in the state of Tennessee, and someone who is celebrating 30 years with my wife, Joan, whom I met in a Bible study in Nashville. You don't get more Nashville than that. Members of the LGBT communities are everywhere, demographically diverse, and represent all segments of our society. However, LGBT people are largely invisible in federal population-based efforts because we are not counted. Because sexual orientation and gender identity are not collected during the U.S. Census, the precise number of people living in the U.S., as well as their age, geographic, race, ethnicity, income, and regional distributions are unknown. Without these data, national population-based studies, such as the National Health and Nutrition Examination Survey, are unable to generate sampling frames. This inadequately accounts the disproportionate geographic distribution of resources. In 2010, the NIH commissioned the National Academy of Medicine to study this issue. The Consensus Committee poignantly stated, "The relative lack of population-based data presents the greatest challenge to describing the health status and health-related needs of LGBT people." They went on to emphasize the need for national research efforts to explicitly include data measures. The All of Us research program does just that. We are an underserved and understudied population vulnerable to poor health. A poll conducted by NPR, the Robert Wood Johnson Foundation, and the Harvard T.H. Chan School of Public Health finds that 18% of all LGBTQ Americans refrain from seeing a physician in fear of discrimination. I'll say that again. 18% of all LGBTQ Americans refrain from even seeing a physician because of fear of discrimination. Data collection has slowed under the Trump administration. In the past 15 months, surveys collecting data on participation in Older Americans Act-funded programs and Administration for Community Living-supported disability services have removed questions pertaining to sexual orientation and gender identity. In the same time span, numerous political maneuvers have sown uncertainty and distress throughout the LGBT community. We experience health in a unique and healthcare disparity. We include higher rates of smoking, HIV infection, certain cancers, depression, suicide attempts, and delaying access to healthcare, as mentioned. Infrequent collection of sexual orientation and gender identity data in clinical settings makes performing specific studies very challenging. Healthcare providers receive inadequate training in caring for LGBT patients. It often results in the mistreatment or discrimination, which deters research participation. We need to be included and counted in order to learn more about our community's health and to address health disparities. Now is the time to change the future of health in our community. Please consider participating in the All of Us research program. They've erased us from the census. They've erased us from federal government websites. They've erased us from crime data. And they've erased us from civil rights protections. With the All of Us research program, they cannot erase our DNA. Thank you, NIH, for including literally all of us.